Greetings, everyone. Thank you for taking the time to join us at the Women and Transport Africa Conference organized by Flone Initiative. My name is Naomi Mora. I'm currently the Executive Director of Flone Initiative. Today, I am honored to be launching Flone Initiative's report, Moving Barriers, Increasing Access, an assessment of the mobility of people with disability in partnership with Frederick Elbert Foundation, Kenyan office. Just give me a minute. Let me just get my presentation started so we can delve deep into this report. So Flone Initiative has over 7 years experience in designing, implementing, and coordinating programs in public transport. In addition to conducting research in the field of transport and mobility and organizing inclusive dialogues, just like the conference, that provide a platform for professionals, researchers, and policymakers to engage in skill building, idea sharing, and learning that will inspire new solutions to transport challenges. So today we are going to be launching this report. And the rationale for this report is that people with disability are the world's largest minority, accounting for 15% of the world population. However, they have lower education achievement, less economic participation, and higher poverty levels than people without disability. So they have higher poverty levels than people without disability. And this can be partly attributed to existing barriers in accessing services such as transport, as well as information. Now, our research covered the Nairobi metropolitan area, and that is Nairobi City, Machakos, Kiambu, and Kajiado, where people with disability account for about 0.4% of the population. And majority of these people use public transport while accessing services from Nairobi City. And out of this population, persons with physical challenges represented the highest proportion with 0.7, followed by those with visual impairments. And the majority of these at one time seek services in Nairobi and use public transport. So this study represents a plan for accessible public transport services. So I've already talked about this, where we found that most of the people with disability have mobility difficulties, that is physical impairment, at about 0.7%. The objectives of the study was to identify the current policies and programs promoting accessibility in public transport, identifying the technical and social and policy gaps that hinder the implementation of policies and programs promoting accessibility in public transport, providing recommendations to guide the improvement of accessibility of public transport, and also documenting the best practices that can be replicated in other counties in the country. And so why is this research important in Kenya? We all know that public transport in Kenya is dominated by informal paratransit vehicles, commonly known as matatus, which are 14-seater, and low-capacity buses that ply within the Nairobi metropolitan route. And in order to meet the diverse transportation needs of the growing urban population, the government of Kenya has attempted to expand the service by allowing private transport operators to operate in the sector. Recent reforms in the industry promote the introduction of higher capacity buses, for example, the Bus Rapid Transit or BRT. And we've also had some progress in the legal notice by the Kenyan government, also allowing for better regulation of the public transport sector, especially on vulnerable groups like the old and people with disability. However, it is still very unclear whether these efforts have improved the needs of persons with disability. And so we also looked into the legal framework and explored the legal instruments, policies, and plans. And we found that Kenya has ratified and has in place several laws and policies that provide for accessible transport. And starting off, we'll start off with the Convention on the Rights of Persons with Disabilities, specifically Article 9, which requires the state parties, which Kenya has already ratified, to take appropriate measure to ensure that people with disabilities access transportation equally with others. We also have the Sustainable Development Goals. The Sustainable Development Goals promote the agenda of sustainable transport. It also acknowledges that transport aids are important in overcoming the social exclusion of vulnerable groups, and also promotes the agenda of participation in planning for accessible transportation. And this is directly addressed in SGD 9 and 11. Next up, we have the Constitution of Kenya that explicitly provides accommodation and non-discrimination providing to the rights of Kenyan citizens. In Article 54, it provides that a person with any disability is entitled to reasonable access to all spaces, public transport, and information. We also have the Persons with Disability Act of 2013 that recognizes that people with disability are entitled to a barrier-free and disability-friendly environment that will enable them to access buildings, roads, and other amenities, and also equipment to promote their mobility. And so in this research, we collected both quantitative and qualitative research, and in three forms. So the methodology was looking at how accessibility is the ultimate goal for transport planning. And we divided this into various sections. We have accessibility, where we looked at to what degree is transport services able to help both the individual and community achieve their mobility goals. We have another segment of availability. How effective is public transport to its users? We also looked at affordability, and that is the ability to meet the demand given the existing resources. We looked at how accommodative is public transport. Is it able to meet the passenger needs? And how safe is it? And how reliable? And based on this, we conducted focus group discussion, key informant interviews, and sent out a questionnaire. And in total, we had about 233 respondents. And so this led us to look into the policies and programs that have already been implemented or at least adopted. And one of them is the Kenya Bureau of Standards back in 2018, which talked about which provided a standard for passenger vehicle body construction specification, or as we like to call it in Kenya, fabrication. And the standards defined a passenger with reduced mobility, especially the elderly and people with disability. And in addition, the standard provided the accommodation for persons with disability and the elderly. We also have the National Building Code adopted in 2020, which also provides special requirements for people living with disability and provided specific guidelines to inform the construction of social amenities to ensure they're accessible. Now, from the research, most of our participants had a physical challenge at 58%, and most of the respondents were also from the Nairobi City County, followed by Kiambu County, Machakos, and lastly Kajiado. And again, just to emphasize that the users or participants from these four counties were targeted because most of these public service vehicles fly to and for the Nairobi city. In addition, we found that Matatus were the most preferred means of transport at 77% by most people with disability. However, despite being the preferred mode of transport, the majority, about 66%, felt that the matatus were ineffective and unreliable. And so when we look at the challenges, I've already talked about this, that 66% of them found matatus to be not efficient and unreliable. When we look at the major challenges, one of the major challenges was the lack of adequate financing. The Kenyan government has developed an elaborate plan of mass transit. Most of it made the commuter rail and also the bus rapid transit. However, the implementation of such a plan has been impeded by resources, and that has, again, not helped the situation of helping public transport be accessible. There's also been the weak coordination. Yes, the weak coordination of transport incentives. For example, at the time of the research, the Green Park Matatu Terminus had just been launched. And this is some of the sentiments shared by participants. There's a male here who has low vision, and when the Green Park station was being tested, he said that the bus stopped at a very far place from the usual stage, and he had to walk all the way. Hence, it took him much more time than expected, and especially the fact that the road had obstacles all over. And this calls into the need for public participation before implementing projects. Another problem was, next slide, the inaccessibility of public transport vehicles. We found that most of the paratransit vehicles used were largely inaccessible, with about 77% of the participants feeling that the matatus were not easy to board, and that the available seats in the matatus were not adopted for persons with disability. There's a quote there from one of the users where it says that the spacing of the seats inhibits a person with disability from sitting comfortably. In addition, another sentiment shared is that it's not possible to accommodate passengers on wheelchairs on matatus, as they require additional spaces which might prompt removal of some seats, which, as a result, can be a loss to business. It can also be possible, according to this matatu staff, that the government comes up with policy recommendations for unforeseen losses, and we'll talk more about that in the recommendation section. Another problem was the undignified handling, stigma from operators and passengers, and use of unfriendly language. Here, I will just let the quotes speak for themselves. A male user who is blind talks about the harassment they faced because conductors tend to compete for passengers in a quest to get them to board their matatus. A female caregiver who has a child with autism says that autism, as we all know, comes with a sensory disability. And so the loud music in matatus overwhelms the child. And so many times matatu will just leave rather than switch off the music or videos. Another problem was the discrimination of persons with disability while accessing the public transport vehicle. And most users with disability, about 60%, reported being left by a matatu because of their disability. They also felt that because some staff perceive them as a burden. And in addition, we found out that there were other users with disabilities who are also known to take advantage of matatus by feigning disability, and others do not wish to pay the fare. Another issue when it comes to fare was the high and unregulated fares. And this is highly because of fares are determined by the operators, and hence considering that many persons with disability have low income, it becomes difficult to afford the undetermined costs. I think there we have a quote where we have You see, according to our research, about 35% use over 200 shillings daily. And if they have a wheelchair, we found out that they incur cost of up to 3 times what somebody who does not have a disability incurs, especially if they have a caregiver or if they have a wheelchair. Another issue was the poor inaccessibility of infrastructure and amenities. 81% felt that bus stations do not have adequate amenities such as toilet and hand washing points and benches. And even if they were available, 83% felt that those present are not adapted to fit their needs. And we have a couple of quotes there where the toilets in the bus station, according to a stakeholder in the public transport sector, are not accessible and are dirty. Yet we expect people who are blind to be able to navigate the use of the washrooms by using their hands. In addition, there was a male with a physical challenge who was part of the focus group discussion, who talked about working at the headquarters of the National Council for People with Disabilities. And they have tried to follow up on getting a footbridge, but that has not been possible. Yet, it's right outside their door as the National Council for People with Disabilities. Another issue was the ineffective reporting mechanism in public transport. Many people with disability felt that reporting cases will not lead up to any follow-up, and many did not even report since they felt that there would be no action by the SACCO. And even when the reporting channels are provided, it becomes difficult for staff to communicate with passengers with disability. We also have a couple of quotes from the focus group discussions. For example, one from a male user with a physical disability, where she says it's very hard to report these incidences because they happen so quickly and the vehicle is in such a hurry that even the vehicle registration is hard to pick. And in addition to that, you do not know the process of reporting. Another problem was the lack of adherence to designed or designated terminus by public transport operators. Many of our participants reported issues and concern with how matatus drop them off at any point, to the point of risking their lives, and may normally lead to incurring additional costs for transport due to the unintended drop-off point from their destination. We also have a quote there where a lady with a physical challenge talked about her experience at a matatu stage where she fell while alighting. And when the bystander asked the conductor why they let me fall, the conductor replied that he was not the one who caused her disability. She got bruised and was angered and felt demoralized to the point of wondering why she was disabled. And so we are not yet done. There are a lot of issues in these areas and how matatus and public transport in general has been inaccessible to people with disability. There's the issue of inaccessible information and communication barriers. 57% of the respondents felt that did not see the road signage, and there was no terminus information provided in terms of transport. And then also it is very difficult for them to communicate with matatu operators, since most of them do not have experience or skill in dealing with people with disability. There was also the issue of low safety from traffic, and majority, about 70%, felt that they were not safe from vehicle traffic. For example, there's a quote there from a female user who has a physical disability, where she talks about the vehicle door knocked her when she was alighting, and unfortunately, the vehicle was also speeding off in a hurry. We also have issues of insecurity in matatu. There was sentiment from a male user with albinism and hence has low vision. And he talks about how due to his low vision, he ends up using his phone close to his face. And what ends up happening is that people realize that he's vulnerable. And it's happened more than once where people have snatched his phone from the window. There's also the health effects resulting in overcrowding and loud music from matatus, where we have sentiment from a caregiver of a child with a psychosocial challenge, where she talks about the vehicles are usually so overcrowded and her child normally convulses due to overcrowding inside the matatu. And so based on this, we made a couple of recommendations in the study. And the recommendations are to 3 stakeholders. These are the government, public transport vehicle owners and operators, and non-state actors. It is hoped that this study will contribute to solving the recurrent challenges of unreliable, ineffective, and inaccessible public transport services for paratransit vehicles. So the study has a lot of recommendations, but I've just picked a few and summarized them. To the government agencies, the study recommends enforcing of existing laws and policies. And I've already talked about the policies that Kenya has ratified or adopted. Recommendations to matatu owners and operators to promote pro-disability vehicle modifications, reporting mechanisms, and capacity building programs. And lastly, to non-state actors to advocate, promote, and lobby for pro-disability interventions. And this marks the end of my presentation. This report is available on our website, www.floneinitiative.org, and it will also be posted on Flone Initiative social media on Facebook, Twitter, Instagram, and LinkedIn. And once again, I want to thank you for making time to join this session. I look forward to answering any questions or input you might have. Thank you.